Peritoneal dialysis, the importance of a healthy diet and exercise. Welcome, peritoneal dialysis patients.
It can be daunting to learn about the best diet options for your renal disease and about what exercises may work for your lifestyle and diagnosis. With this presentation, we aim to provide a resource for peritoneal dialysis patients and their family members to explore healthy diet and exercise options. Peritoneal dialysis is a procedure that is done with patients in kidney failure. The blood is cleaned inside the body using the inside lining of the abdomen, or the peritoneum, as a natural filter. A catheter is placed in the abdomen, and the abdominal area is slowly filled with dialysis fluid through the catheter. As blood circulates through the blood vessels that line the abdominal area, extra fluid and waste products are drawn out of the blood and into the dialysis fluid. The dialysis fluid is then drained from the body after the cycle is complete. There are several different types of peritoneal dialysis, which may be completed throughout the day or overnight. Exercise can help prevent many of the complications commonly seen with renal disease, including unmanaged blood sugar and weight gain. Some of the barriers that many peritoneal dialysis patients report to exercising is tiredness, weakness, body pain, being worried about a fall, or not sure what exercises are appropriate for them or how often they should be exercising. It's always best to talk to your doctor about the benefits and risks of exercise for you before you begin any new routine. Your doctor will know what is best and safe for your specific medical history.
Why should peritoneal dialysis patients exercise? The more I exercise, the better I sleep. The better I sleep, the better I feel. The better I feel, the happier I am. The happier I am, the more I try to accomplish. The more I try to accomplish, the more I do accomplish. The more I accomplish, the more optimistic I feel. The more optimistic I feel, the better care I take of myself. The better care I take of myself, the more I exercise. And the more I exercise, peritoneal dialysis patients should exercise to prevent loss of muscles, to maintain weight and avoid rapid loss or gain, to postpone physical decline, to enhance your ability to take care of yourself, to create an optimistic and active life, to improve your mood, to reduce medical costs, and to improve your appetite and nutrition.
In addition to maintaining a nutritious diet that includes sufficient protein intake, it's crucial to emphasize the significance of physical activity for enhancing the quality of life in peritoneal dialysis patients, also referred to as PD patients. PD patients are more physically inactive to those who are on hemodialysis and frequently encounter obstacles to engaging in exercise. These obstacles include issues related to the catheter and determining suitable physical activities. It has been found that PD patients are not provided the education by their physicians regarding the importance of exercise and how to exercise. Despite patient hesitancy, physical activities can be conducted safely either with the dialysate inside of the body or after it has been drained, with guidelines stating that more strenuous activities should be done when the dialysate is not present and less vigorous ones when it is. Engaging in regular exercise programs can enhance muscle strength, flexibility, and muscle endurance, leading to better overall physical function in PD patients. The exercises demonstrated in these videos can be performed with or without the dialysate in the patient's system and also require little to no equipment. The intensity of these exercises can be increased as the patient's condition improves and strength develops. The first part of the program is flexibility. This helps to increase the range of motion and decrease the risk of falls and injuries. The next is aerobic exercise. Low-impact exercises like walking can be done virtually everywhere and provide numerous health benefits such as maintaining cardiovascular health. The last part of the exercise program is muscle strengthening exercises. To improve overall muscle tone and strength, which is important for tasks involved in daily living, such as climbing stairs and lifting heavy objects. These exercises demonstrated are primarily body weight exercises or seated exercises with dumbbells. While these types of exercises can be done at home, it is encouraged for PD patients to join a gym or find a workout partner or groups, as their treatment makes them prone to social isolation.
Many patients receiving peritoneal dialysis have a hard time sticking to a healthy diet that is safe for their renal condition. Some barriers include feeling too tired to cook, not having an appetite, or not being informed about what foods are good for them. As with exercise, following a healthy diet can help prevent complications of your kidney disease and avoid developing other illnesses such as diabetes or heart disease. A combination of exercise and a healthy diet can help control your blood glucose levels if you already have diabetes. This can aid in preventing further damage to your kidneys. Overcoming the barriers is possible through education on what is healthy for peritoneal dialysis patients, as well as some planning around your meals. Patients with renal disorders on dialysis usually need to follow a high protein, low sodium, and low potassium diet. This should be mainly whole unprocessed foods, vegetables, and lean meats, as well as foods with lower sodium and potassium levels. Following this dietary plan can help to prevent electrolyte imbalances, issues with the cardiovascular system, and low protein levels in the body.
Renal disease can cause potassium to build up to dangerous levels in the blood, which can cause problems with the heart muscle. It's important to eat fruits and veggies that are lower in potassium to help avoid this. These lists provide examples of some low potassium options, such as asparagus, carrots, cauliflower, celery, summer squash, zucchini, apples, blueberries, pears, raspberries, and strawberries.
MyFitnessPal is a health and fitness app that allows users to track calories, monitor progress toward goals, and gain support through an online community. The app allows you to set a food goal for the calories, add amount of calories in food that you ate for the day, and even calories burned during exercise. This is a nice app for those with peritoneal dialysis, and even if you don't have peritoneal dialysis, to just have a better understanding of the food that you are consuming. Here are some pictures of what MyFitnessPal looks like when you search up a food option. So the most important thing that the patient undergoing peritoneal dialysis will utilize with MyFitnessPal is the nutritional facts label. It gives you literally everything that's within the food, and a patient trying to keep their diet low in phosphorus, sodium, and potassium and isn't really sure what the nutrition is on that food. It's just that simple with either searching up the food item or scanning the food that's in question with the barcode. So this image from my plate gives you specific healthy eating options that are low in sodium, potassium, and phosphorus, which is just what a patient going through peritoneal dialysis needs. The important part of this informational picture is to know what is considered a serving size for each food group. It is important to eat within the recommended serving size to prevent eating foods too high in sodium, potassium, and phosphorus. So the recommended dietary intake for potassium is 2,000 to 2,500 milligrams per day. Phosphorus is 800 to 1,000 milligrams a day, and sodium is 2,000 milligrams or less. Some of you may be thinking, well, how do I know that I have stayed within the recommended daily intake? And that's a good question. And MyFitnessPal is an option where you can figure that out.